here's a question for you. How many people or people that you know has had a condition called frozen shoulder? Say, raise your hand. Okay. For those who don't know what frozen shoulder is, for the people who do know what frozen shoulder is, I would say what happens with the shoulder when it gets frozen. This is what happens. It hurts to move it all the way up. So you stop moving it all the way up. So then you move it only to the ability where you can. And then after that, you can't move it even to that ability. And then slowly you lose the range of motion. Does that sound familiar to the people who's had it? Yes. How long did it take for you guys to treat it? To treat it conventionally? Okay, show of hands, let's say 3 months. 3 months? Yes, that's on the average about 3 months conventional. In my office, when people come in frozen shoulders, with my treatment protocol, they're usually done within probably about 3 weeks. 3 to 4 weeks. I always say, I always give a range about 30 days, give or take a week. Hey, if it's under 30 days, it's a gift. If it's over 30 days, we got a little bit of work. So definitely coming to my office, I treat frozen shoulder a lot. And how do I treat it? Chiropractic manipulation. Acupuncture works phenomenal for frozen shoulders. I have low-level laser therapy. That works as well. And also do massage therapy. Yes, it doesn't really feel good, but within 30 days, I got it going about 90%. Now again, how many people would love to have 90% range of motion back within 30 days as opposed to 3 months? Raise your hands. Yes, exactly. So again, frozen shoulders, a disorder characterized by pain and loss of motion or stiffness in the shoulder. It affects only about 2% of the population. It affects more women than males. Just keep that in mind. Yes, it probably sounds sexist, but for some odd reason it affects more women than males for the frozen shoulder. They say it's tied into the thyroid and so forth and so on. I understand the biomechanics, but I'm not going to bore you with any of that information. But definitely, I treat a lot of frozen shoulder in my office with success.